I'm Dr. Alicia Olivier, and I'm originally from Ocean Springs, Mississippi, and I attended Mississippi State College of Veterinary Medicine and graduated in 2005. After graduation, I went on to do a residency in anatomic pathology and a PhD at Iowa State University. I started my first job at a college of medicine as a pathologist, a veterinary pathologist, and then moved back to MSU-CVM to teach, work on the diagnostic service, and do a little bit of collaborative research that I'll talk about. So I'm really happy to be here to represent really what I consider a behind-the-scenes job. I'm a pathologist in the diagnostic laboratory, and the diagnostic laboratory provides services for our clinicians here at the hospital, as well as clinicians from around the state. And we'll talk a little bit more about the diagnostic laboratory in a few minutes. But let's just talk about what an anatomic pathologist is. So a pathologist, and the study of pathology, is really the study of disease. And disease meaning any change from normal. So that could be something you can see with your eyes, so a lump or a bump, something on the skin, or it might not be something you can see with your eyes, so something internal where a clinician has to biopsy it, take a little piece of it and give it to us. And it could even be something that looks normal, but actually when you put the tissue on a slide is not normal under the microscope, so at the cell level. So that's a lot of what I do. I look with my eyes at what we call a gross change. It's not really gross, it's something that you can see with your eyes. But then I look at a lot of changes at the cell level, so using microscopy. So as a pathologist here at MSU-CVM, I mentioned that I spend a lot of time on the diagnostic service rotation. And that means that I'm looking at biopsies, so little samples of tissue from animals within our animal hospital. And I'm also on the necropsy rotation, so I'm seeing animals that have passed away. So in addition to the diagnostic service that I do here, I also teach our veterinary students. So I teach in the first year curriculum and in the third year. And so in the third year, our students come for 4 weeks and spend time on our service looking at pathology every day. So they're looking at microscopy lesions, but they're also spending time on our necropsy floor looking at why animals die. And why is this important? Well, this is important for many reasons. The first and foremost is that our diagnostic lab here supports and protects the healthcare of animals throughout the state, importantly herd health animals. So if we have several cows dying on a farm, the client or the farmer submits them to our diagnostic lab to figure out why they're dying. And this is important so that they can protect or treat the other herd mates that are still on the farm. So that's a really important service that we provide. Additionally, we see animals, particularly small animals, from clients that may have come home and their animal may have passed away. And so in that case, we can provide a lot of resolution to those clients and help them understand why their pet may have passed away. So I think I really find that to be an important part of my job, to help people walk through that grief process and understand why that happened. Also, we're always learning. We always need to know and figure out disease. How can we do better? How can we treat? So if we don't understand the disease process that's ongoing, then we can't treat it. So we always want to know, how can we treat it? Is it treatable, or what is the outcome? So today we're here at the College of Veterinary Medicine Diagnostic Lab, and we're at sample receiving. But I think it's important to note that we have several other facilities within our diagnostic lab. We have 2 in Pearl, Mississippi, and 1 in Stoneville, Mississippi. And these labs all service different industry. This is where our samples come in. So this could be biopsy samples from our animal hospital, or submissions for necropsy to evaluate the body for the cause of death. Now we're going to the Histology Lab. As I mentioned, pathologists look at a lot of slides. So we have a Histology Lab that's dedicated to making slides that we look at under the microscope. So let's go in and take a look. today I'm looking at biopsy slides with our second year anatomic pathology resident, Dr. Sam Hughes, and we are going to go over a case together. So today we're looking at a sample, and this sample is from a patient in our clinic. And can you give us the history, Dr. Hughes?
Sure. This is a 7-year-old beagle mix from our clinic that had a large ulcerated mass on the dorsal neck.
So this is the section, the histology, that Dr. Hughes and I examined under the microscope from the lump on the skin of a dog. And so what we can see here is that we've got some really crazy cells. We actually see nothing normal that we would normally see in skin. So we know that there are increased cells here, and that these cells have a morphology that we call a spindle cell. So they're a really elongate cell. And the real important feature of this histology is that these cells form blood vessels. And these are not normal blood vessels. These are neoplastic blood vessels. So neoplasia means abnormal proliferation. And what's really cool in this sample is that we can see that these cells are proliferating. Do you see this little area here where there's this really dense blue material that has this elongate look to it? That's an example of a cell dividing. So we can see that there's a lot of cells dividing within this slide, meaning it's growing very fast. And so this is a cancer of blood vessels. So there's lots of different cancers. You can get cancers of really any component of your body, but this is specifically one of blood vessels. So what is your diagnosis for this sample?
So for this sample, this would be a cutaneous hemangiosarcoma in a dog.
So that's our goal in the biopsy service. We received a mass from a dog. Where was this mass located?
Dorsal neck.
Dorsal neck. And our diagnosis is a hemangiosarcoma, and that's a tumor of blood vessels. So in this case, this was cancer.
Yes.
So what are they going to do about this?
So the sample that was submitted, it didn't have great surgical margins. So one thing that they could do is go back and maybe reassess. So I can't tell them if they got all the mass because I could not see that grossly, or I can't see it histologically here. So going back to reevaluate their surgical site, consultation with a veterinary oncologist is always recommended in these situations, but generally the cutaneous versions of these tumors are less aggressive than the visceral tumors.
So the tumors in the body systems, in the organs, in the abdominal cavity. So great, a great example of why we need histology to understand what the diagnosis for a lump or a bump on the skin is.
Yep.
So wonderful. So as a pathologist, another component of my job that I mentioned before is necropsy. So we're off to necropsy this afternoon, and we have a calf that presented to necropsy for being found dead. So this is a 6-month-old calf, and there's 10 others on the farm that are sick. The owner said that the other calves on the farm are not eating well, and they have sniffly noses. And there's a little bit of coughing going on. So the first part of our necropsy examination is to look at the body externally to make sure that the hair coat looks good and to see the nutrition status of the animal. I want to show you the lungs of a normal calf, because to figure out abnormal, you really need to know normal. So what I'm showing you here are lungs from a normal calf, and you can see that these lungs are pink and well inflated. That would be normal for lungs. And now let's take a look at the lungs from the calf that presented to necropsy today. What you can see is that the majority of these lungs, as indicated by the arrows, is deep dark red with little white areas. And if you felt these lungs, they're very firm and heavy. The only normal part of the lung is at the very top, right above the arrows. That part of the lung is still nice and pink and fluffy. So this is very characteristic gross lesion. Remember gross, what we're seeing with our eyes, of pneumonia, and specifically a bronchopneumonia caused by a bacterial pathogen. So the next step after we do the necropsy is to take tissues from this animal and make microscopic slides. And then we look at the slides under the microscope to prove our findings from the gross exam and finalize a diagnosis. So let's take a look at the histology. On the left is normal lung, and you can see that in this normal lung there's lots of white space. This is normal. The function of the lung is to provide oxygen to the bloodstream, and so you need to be able to take in air and to oxygenate the body. And on the right is a image of the histology from this calf. And what you can see here is you don't see any white space at all. And the arrows are indicating an airway that is just filled with all this purple material. And this purple material is inflammatory cells. So bacteria are present here, inciting inflammatory cells to come to the site. All around, you can also appreciate that there's lots of pink material, and this is consistent with increased fluid in the lung. And you can imagine that with this many inflammatory cells and fluid, this calf could not take in air and breathe. So importantly, we told this owner that this calf had a bronchopneumonia, and that provides information to treat the others on the farm. Thanks for watching today. It's been great to share with you what I do as a pathologist at MSU CVM.